Good afternoon, everyone. Afternoon. I'm just gonna ask those who are quite at the back, can you move in front and fill the spaces in front? Thank you so much. They are going. Okay. Oh, thank you so much. Thank you. Well, I'm Shinain Mushonga from Africa Jandiri. I'm going to be taking you as the overall co-chair of this session, Youth at the Center and Community Mobilization for Youth-Friendly Services. So for now, I'm just going to ask you a favor. I'm full of favors of asking, so I hope you're going to like the way I am. For now, I'm just going to ask you all a favor that can you all both act like youths, right? Yeah. Act like my age. Act like you're 16-year-old, you're 15, you're whatever, right? So that you can feel the youth vibe in here. So this is the workshop we have been waiting for, community mobilization for youth-friendly HIV services, hashtag Youth at the Center. We have different objectives which we have aligned in this session, and I hope you're going to feel the vibe and all the overviews. We have different methodologies. So the objective of this session is more of linking to our theme, breaking barriers and building bridges. So this workshop, we're going to have a format style that we're going to have the common challenges of young people living with HIV, and there are going to be young people who are going to do a different thing, and you're going to see it. I'm not going to tell you what it is. It's a secret, because if I tell you, it won't be a secret anymore. And we're going to have group discussions. We're going to have an overview, and we're going to have different things we're going to share with you. So right now, I'm going to call upon some wonderful young people who are going to have the part one session of the community common challenges faced by young people living with HIV. And I'm going to call upon Tanaka George Chiromba from Youth and Society from Malawi, and Etya'ale Motumo from with South Africa, as well as from Pakamani. You're going to come right now to do the first session, the first part. Okay. Before that, I would need 2 volunteers who are willing to come up front. If you don't, I'm just going to pick randomly, and I'm a good picker. 2 volunteers. Wait. Huh? One more. Yes, Ndorozo. I just heard your name. Ndorozo, come up front. Oh. Okay. No other volunteer? Yeah, thank you so much. Thank you. Thank you. So what I want you to do, it's an icebreaker. Since we are here at Amsterdam Conference AIDS 2018, I want you to ask each other questions, what you've learned from this conference, and answering from each other. If any of you in the audience would like also to engage, please do feel free. We are all 15-year-olds. Don't want to hear anyone saying, I'm 65, I'm 40. Right, okay, so. Okay, the mic.
Is it on? Yep. Hi, my name is James. I'm from the UK and I'm 15 years old. Are you the same?
Well, I'm from Lebanon, I'm Islam, and I'm 14 and a half.
14? Ah, okay. A bit older. How are you finding the conference so far?
It's fun. I like it. It's cool.
Cool. You learned a lot, do you think?
Yeah, the food was good.
Yeah, it was.
Good.
Amsterdam's fun as well.
Girls and boys my age are so nice.
Yeah.
And I got to know a lot of cultures and people from different. Sorry.
Oh.
And people from different countries. And yeah, I've learned a lot.
What's been your favourite session so far, would you say, apart from this one?
My favorite session was the session of the Pass the Mic with the team's representative and the discussions with the Shari's theatre.
Nice. I didn't go to that one, but I've been around the Global Village a lot now. I think that's got a really, really active, vibrant space. I'm especially kind of seeing all the young people, and especially the Youth Pavilion as well. People my age being there and kind of showing off their work. And I think I can bring a lot back to the UK in terms of my advocacy and my work as well. I go back too.
Yeah. Well, the Global Village, I went just today. And I've seen a lot of activity, and I like the activity. I also watched the play, the opera.
Oh, nice. Yeah.
I forgot the name. And I watched some videos, and I saw some of the booths, and they are really very engaging, you know.
Definitely.
Can you hear me? Okay, we'll wrap up. Thank you so much for the icebreaker.
Thank you.
I hope you've seen that we have learned a lot on this conference. And do please enjoy. Right now I'm going to give to the young beautiful. And can you give a round of applause for our two beautiful people here? Okay.
Ish, Cecily, we are already late at work.
Why there's so many people?
I think today we have more than 30.
Oh, I'm tired. Let's go for tea. It's still early in the morning.
Okay, you can prepare the tea and come with it.
Okay.
Hey, I'm going to school right now. I have to go. I don't have time for lighting. And today it's cold. Hey, Tumi, I'm still waiting for the tea.
Come to me. Forget about people.
I have to go to school. No, I said you should make some tea and you are still busy doing some makeup.
I have to look beautiful.
I said I need tea.
What time is it?
I think it's around 2 to 10, somewhere there.
Oh, okay. Hey, let's go to them. Positive. Okay, it's the red file. What's your name again?
Yes, come in.
Can you please start with me? I have to go to school.
Start with you.
Yes.
But he's the one who's at front. So you have to sit down. Can you please sit
No,
down?
I'm also in front.
Can you please sit down? Tanaka, how are you?
I'm good, and how are you?
I'm good. How are things?
Please make it fast. I have to go to school.
Can you please wait? Are you taking your medication?
Yes, I'm taking. I'm not even missing any single day.
He's
Okay.
doing everything.
Can you please wait? Okay. Any challenges?
No challenge.
No challenges. Okay, that's good. Tanaka, are you sexually active?
Say yes, man. I have to go to school.
Tanaka, I'm talking to you and you are busy watching, looking at that one.
You know what? I think you are going to take a lot of time. You're asking me sexual active. Next thing you're going to ask him is what. Let me leave. I'm going to school.
Are you sexually active, Tanaka?
No.
Okay. Okay, thank you, Tanaka. You can go to the receptionist and go and get some services.
Not you again. Not you. What you want?
My medication.
Medication. Oh, ARVs. You people and your ARVs. Go to that room. Go to the chemist.
Tumi, how are you?
Oh, hi, doctor.
I know, when you see yourself coming into my room, I know you want to gossip.
So, why was he here?
Can you imagine that one who just left, the first one? He came here and he says he wants to go to school. And he can't even wait for me to finish with the first client. And then now he's saying that he has to go to school. And it's the same child who came last time with STIs.
Oh,
Can you
these
imagine?
young people, adolescents, they sleep around. I'm tired of them.
Can you imagine? And they don't even use contraceptives. And they don't even
How
use
can we
condoms.
expect young people to use condoms? These people.
And I'm even tired. Can you see the line outside? I think I'm going for lunch.
Let's go. I'm joining you.
Wow, that was wonderful, right? Yeah. This was a role play which is done by beautiful Paramani and other young people who are in here. So I just had randomly picked some people inside in the audience so that they are going to come up here and tell us what was wrong in this role play, what should have been done in the delivery of the services to the adolescents and everything. But right now, we're not going to do it right now. We're going to do it later. For now, we're going to have the second part of the session, whereby we are going to invite where we are going to have a community-led demand creation by and for young people, which is going to be a 20-minute session. So this is going to be led by Kelvin, and can we please welcome Kelvin on the floor? Okay.
Yep. Thanks, everyone, for coming in. I know that this is, I'll need someone to move my slides, because is this user-friendly for me? I know. Good that you all saw that. So, my name is Kelvin. I'm from Zimbabwe, and I work for the National Network of Young People Living with HIV, which is known as Zimbabwe Young Positives. And my duty here is to actually talk about how we can actually do demand creation and how we define demand creation for young people and adolescents living with HIV in their diversity, whether they are coming from the key population sector or they are just general young people. But the common binding thing is that every young person who is actually living with HIV has specific needs, has specific demands that they need from service providers. So I'm going to go through my slides, and after that, I'll actually open it up for the floor to actually help and inquire more if there is need, and also add some interventions if you feel like. So please, when we're talking about demand creation, for me, my definition that I felt like is appropriate is that it is a process of engaging communities to access services and programs through the provision of information and knowledge building. By this, I mean that when young people go to ask for services, they should be knowing what kind of services they are looking for. Because you can, as a young person, you can't demand or you can't ask for something that you don't know about. So the first thing that you have to do is to make sure that you know about the service and you ask for it. And you actually know if there are side effects or the goodness of the service that you're actually going to be demanding. So for me, better access to health services and programs, that is actually equals to improved health outcomes, adherence, and quality of life for recipients of care. So by this, it's actually more of a breakdown of what I actually had spoken earlier, where we're actually saying young people design the programs that are actually beneficial to them, and actually making sure that by knowing the models of care that are available to them, when you're talking of models of care, these are supposed to be client-centered. When you're talking of client-centered models, it's more of reducing the cost or the burden to the clients. In this specific, we are talking about young people living with HIV who are in those communities, hard-to-reach communities. What other models can we use? The first model that I can actually think of, for me, is the way of using support groups, where those young people themselves, they are in a support group and they send either one or two to get their medication if they are not actually symptomatic or do not require a doctor to actually go and do a full review for them or to them. So this varies as in perspective for different countries or different areas where they come from. But for those who are coming from other areas where the groups of young people are symptomatic, they actually can be led by the healthcare provider or someone who is actually a professional who can actually help and assist in getting medication or actually prescribing or giving new interventions that are actually available to them. And also, moving on, for me, I felt like differentiated service delivery is part of demand creation. For the definition for differentiated service delivery is that this is a client-centered approach where I actually said where these young people or every client who is a recipient of care is actually in charge to making the decision of how they want to get the services to them. It simplifies and adapts HIV services across the cascade of HIV care to reflect the preferences and expectations of various groups of people living with HIV, whilst reducing unnecessary burdens on them. Adolescent-friendly services is also part. This is also accessible, acceptable, appropriate, effective, and equitable. By this we mean that providers of these services are sensitive to young people clients' needs. They encourage autonomy and demonstrate respectful and non-judgmental attitudes. They know of the importance of adolescents, give them privacy and confidentiality when they're actually getting services. I understand that when we had this role play, this was more of an introduction of some of the ways young people receive services in hard-to-reach areas or in a service provider where they don't have these good quality services that are actually client-centered with specific to adolescents and young people. So the expectations for adolescents and young people is actually to have people who are not judgmental to them, people who can actually listen, talk to them, give them direction in what they want to get. When you want to get a service, you expect to get to be in a one-stop shop. By one-stop shop, we mean that you ask for a service and you get a comprehensive package. With that comprehensive package, there has to be enough knowledge and guidance to make sure that young people know or get what they deserve. Something that is not limited to a specific need, but but a comprehensive package. In our own words as young people, we have our asks. Service providers should stop talking to us in an unfriendly way, saying that we are a carrier of the virus. Some of us, we understand that we actually got infected in different ways. And sometimes it's not our choice. It's not our decision to make to be in that position. So we asked that service providers should stop pointing fingers in an unfriendly way or saying that we are the carriers of the virus. We should be treated the same as everyone else. Healthcare providers should be polite. For example, they should smile, just a simple smile. It says a lot to a young person when you get into a room or when you're asking for a service. And also, they should also listen. Just listening, it's enough. If someone is disabled and living with HIV, a nurse might even look at them up and down and ask them if they can actually have sex and how. But is there any difference with someone with a disability of not to have sex, or how do we feel? Does disability come in the process of having sex or just a physical stature in doing things? For me, my understanding is that everyone is disabled and everyone has got their way of doing things. If you do something in a different way than the way I do it, that means you're also disabled because we do things differently. Some may be faster, some may be slower. So also, we feel that service providers should not stop saying that we brought this service providers should stop saying that we brought this upon ourselves, that we are a danger to the community. We are not a danger. We can actually be leaders in change. We can actually be very influential in making sure that we get to those 3 targets. And also, we won't be able to have children. Unfortunately, for me, I feel like that's more of discriminatory because everyone has the right to have children. Everyone has the right to have a private life. I can give you an example of myself. I'm married. I've got kids, 2 very beautiful kids, and I'm very happy. But that stopped me to actually being a young person who is also living with HIV and enjoy a much enjoyable life just like anyone else. No. So make sure that when these are actually being brought about by everyone to service providers, let's at least try and consider the basic needs and understanding of the young people living with HIV, and actually by putting them at the center of service delivery and service provision. Thank you very much. I know that this was a very small presentation and there are so many aspects of service delivery, demand creation that I didn't actually speak about, but I wanted to make it easy for everyone to actually ask questions, because I also believe that sometimes people believe in actually talking to people who are in the real situations, and by those personal experiences, a lot of people can actually learn and understand how young people in our diversity are actually living in these kind of situations and actually making sure that we are leaders in change. I open it up to you. If you have any questions or comments, you can please go ahead.
My name's Adam. I'm one of the board directors of Living Positive Victoria. You mentioned a fair few things that are important to consider for young people that are HIV positive. Out of those, what would be the most important thing that service providers should consider when delivering appropriate services for young people? What's most important?
May you kindly, if you have any questions or if you have any comments, feel free to move around the room. There are mics beside you. You can stand up and also ask any questions about the presentations. Feel comfortable, right?
Okay. Thank you very much for a beautiful question. For me, it depends with the young person and what kind of a situation the young person is in. Sometimes if you're looking for services, you might just need a peer to actually give you direction. If you're looking for mentorship, you can actually work with a peer. If you're looking for something that is actually medicinal, you can actually go to the service provider, trained professional who is actually also able to listen and understand the situation. So it comes with different aspects and variations in the situation the young person is in. But for me, the first thing that I want to actually encourage that is actually important is actually giving access to information. Because you cannot actually ask for something that you don't know about. You cannot ask or demand something that is not well informed to your situation or to your cause. So first thing, you know what you want, make up your mind, be able to make a decision that can actually influence or give you better decision making in the future. Because we cannot only look at now, you also have to consider what's going to happen tomorrow, what's going to be happening in the next 5 years, what happens in the next 20 years. With the new interventions or the parameters that are actually there right now, we feel like even if you're living with HIV, you can live longer as long as you take medication. There is no difference with someone who's actually negative. You can actually have a very fulfilling life, have a full, well-grown family. So let's all think about it and let's work together.
Okay, thank you so much. I'm called Sarah Aporo from Uganda, and I'm really so much inspired by your presentation and the skit that was going on when I moved in. I just have a comment. I don't really have a question as such. Back home, I remember I'm just going to share with you my experience. The first day I tested was in 2017. That's when I got to know that I'm HIV positive. So a day after, I go to my ID hospital, and the first thing the counselor was trying to propose to me was try and get a boyfriend for yourself. And I'm like, I'm just from a heartbreak where the person who infected me, we have just broken up, and here you are trying to bring to me another relationship. I'm still trying to deal with the past relationship. And this is my first appointment with you. So I think also our health workers should know what to tell the patient when I moved in, I saw a skit where just barking at someone is still dealing with the people who are raped and they find themselves having HIV. The people who are born with it. Not everyone that walks into your health facility has the same story. I may have a different story. Someone else has a different story. So the health workers should know the people they're dealing with. They do not all contract HIV from the same source. Thank you.
Yeah, that's really true. And that's where we actually demand and ask for an opening and wide open ear to different stories that we always come in with. Because sometimes we feel like sometimes even our laws and policies within our countries are actually letting us down because there is no follow-up. There is no follow-up because I understand if you're a service provider, you always swear an oath that you always will keep a secret to whatever information that you get from a client, for the client, and also making sure that when you're in for a job, be there to provide the services in a way that next time someone comes back, they'll always try and look for you, try and listen, because this is some of those things that are actually very important. We always try to give, just doing giving the service just for the sake of me, I'm being employed. But sometimes it also needs a heart to be in a situation to provide the service. So with this, if there are any more comments or questions, I thank you. Okay.
Row number 4. My name is Rowan, and I'm from South Africa. And for the last few years, with my partner, we've made Youth Voices films for the International AIDS Society and UNAIDS across the African continent. one of the recurring themes that came up in all the workshops with Desmond Tutu HIV Foundation and Children's Radio Foundation was that there is stigma occurring at clinic level. Everybody knows this. We thought that we could make an immersive virtual reality film that gave you a private moment to understand your journey into status free from stigma that might have come from an unprofessional healthcare worker. So we've actually made 2 films, one aimed at the nurses that are being trained, that are out there, that sensitizes them to what stigma looks like at clinic level. So they, as nurses in training, will pre-visualize and experience in an immersive way stigma at clinic level from the perspective of a young person. And then we've made another film in partnership with Google that talks to youth and helps youth navigate their stigma if they're pre-testing and post-testing and then onto treatment and counseling. So it's in the room. We're here at the invitation of UNAIDS and a number of other partners, and we see some of our friends from the Youth Voices program and all the films we've made in the room. It's lovely to see them here, but we're here. So if anyone would like to watch the film, we'll be around, probably outside. The room's a bit stuffy, so we're going to get out some fresh air, but just outside the door here, we'll be waiting if anyone's interested. Unfortunately, we can really only do one at a time. But yes, if anyone's really interested in navigating their stigma through this film, we'll be waiting outside. All right, thanks.
Okay.
Okay, thank you very much. Mine is a comment on differentiated care delivery and youth-friendly health services. Through experience, I have noted that a lot of young people living with HIV, whenever we go to a health facility, we only focus on our ART and what we are doing that day. We also have to know that it's our duty to demand for youth-friendly health services. That's where we can get more information and have access to. Even the healthcare providers, it's their responsibility to tell us what it means and what are the health services that we can access as young people living with HIV. Even the family planning services, the health providers, it's their duty to tell us as young people living with HIV. Thank you.
Sure. Okay. Thank you very much, and looking forward to the conversations afterwards.
Thank you so much, Kelvin. Can we all give a round of applause to Kelvin once again? Yeah. I feel like the room is kind of low, and I want to feel the vibe in here. But you guys, you're kind of feeling low. Come on, guys. Active energy, right? We are youths, remember. We are 15-year-olds, remember, right? So right now, we're about to break into groups. But I think due to time, we're going to move to the next forum, which is the role of advocacy and activism in demand, which we are going to be sessioned by Wame Monsima, a beautiful lady who is coming out front, and she's active already. Guys, give her a round of applause. Okay. So Wame is going to present on what is advocacy versus activism, as well, and how to develop an advocacy plan. And it will be great that if we could be interactive in this session and share more about what we know about advocacy and what we know about activism and all the connection which we have, right? So I'm giving to you, Wame.
Hello? All right. Thank you, everybody. Good afternoon. No, that's too low. Good afternoon. That's much better. All right. So we heard a lot about demand creation, but the bedrock of demand creation, getting people to access service, is about advocacy and activism, right? So what is advocacy? What is activism? Can somebody give me some wild guesses? Is there even a difference between the two? Thoughts? Come on. No wrong answer here. We're all here to learn. Can you tell me? Okay, who's an advocate? Who considers themselves an advocate? Who considers themselves an activist? Oh, that's interesting. So, yeah, some people raise their hand twice. So what's the difference? Take a wild guess. Is there a difference? Yes or no? Yeah. Show of hands, yes? Okay, anyone dares of the yeses to say why? Come, yes? Great, great. Any others? Yes, in the back? Excellent. So I can go and sit down now, right? Any others? Yeah, Tsapman? Mm-hmm. Wonderful. There you go. The answers are right there. Thank you so much. And that's exactly what it is. An activist, to be an activist is to act on behalf of solving either social or political changes. So someone who is actively engaged in the process of change, right? And an advocate is to speak and learn about social and political issues, right? Someone bringing to the attention the injustices, the issues that we're seeing in the communities. And although there's a difference, like you rightly pointed out, between the two types of people or two types of processes to engage conversation, they work together, right? And we've seen so many spaces that this has happened. I love this quote. It says, to be an activist is to speak. To be an advocate is to listen. Society can't move without both of them. And this is coming from young people who were really involved in the Black Lives Matter movement in the United States. And in our space of HIV, we do both, right? We're both activists and advocates. And what does that mean? We start with collecting information. What is the situation on the ground? What matters to us most? What is happening in our communities, right? The only way we can do that is to understand and unpack the issues, live through the experiences, as you saw from the role play this afternoon. Collect that data and be able now to facilitate the action, right? Be at the forefront, be activists and say, this is what is going wrong with the HIV's response. These are the issues that we're seeing in our communities. And sometimes we have to take very brave actions in order to be heard. How many of you have been activists in the last week? Can you give me some examples? What have you done?
Oh, in particular, I took place in many, Sergio from Paraguay. I'm very glad to be doing this. Oh, in particular, I took some actions with a girl from Argentina last night. She helped me in joining a group of students who are working a lot on gender research, and I joined like a group they were having a small gathering there. It was my very first time there, not directly linked to this conference, but it was an opportunity for me to link some of the volunteers also who are here at the right. It was just one thing.
Excellent. Any other examples? What kind of advocacy and activism have you done this week or last week? Any other examples? I saw some hands. No. Tell me what you did.
Well, I participated from the march.
Which march? Sorry, Mike?
The march on day 1, day 23. Yes, for me that's a way of doing activism. For me also, activism is wearing this shirt with the message that it brings with it. So for me, activism is a way of life. So many things that you do unintentionally is a way of doing activism.
Absolutely.
I think most of the time, Simon from Sweden, I think most of the time when people actually stands up and say something out of their own situation is a kind of activism. Unfortunately, I feel all over this community is a lot of, or this conference is little bit about activism among people living with HIV and a lot about advocacy among people living with HIV. So I would like everyone to be like, be more activists, take the voices, agree or disagree or do things within the sessions, because it's a lot of key population doing their activisms and very few people like myself living with HIV actually taking the step and doing it within this international conference.
Great, around movement building, right? Getting other people to join in on the activism. I'm wearing a shirt from one of our actions that came out recently, right? I don't know if you guys can read my t-shirt. It says, "Are you swallowing farmers' lies?" You know, hashtag farmer lies. You know, these are some of the different types of actions, the messages that we actually have engaged in as an organization based on trying to facilitate better access to more affordable medicines, and really recognizing that many countries are actually struggling to get access to medication. People living with HIV struggling to get good drugs because the prices are high. And how do you fight patents? How do you fight against the bureaucracy in order to allow countries to get better access? So we all have causes. We all have issues that within us are really important and critical. And it's about creating that voice. It's about creating that movement around what we think is important. That's what advocacy and activism is all about. Collect information and fight to create a voice, fight to create a space where we can actually share some of the issues that we're seeing on the ground in the communities. And why advocacy? It's because we want change, right? We want things to be different. We want things to be better. And we can only do that if we sort of take up that action and speak for the issues that we're identifying. And in order for us to build that movement, we have to analyze and assess what are the critical gaps? What is going wrong, right? The scenario that played in the role play is an example of all the things that we're seeing in our communities, right? What are the causes of some of these issues and gaps that we're experiencing? And what is the effect of having these issues or these barriers that we're experiencing? So once you've had an idea to distill and understand what the issue is, and there are going to be many issues. As you see along the cascade that I showed you, you can always identify something's going wrong with prevention, something's going wrong with care and treatment, something's going wrong with viral suppression. But how do we then prioritize what we think is most critical and most important? And part of our role is to say, what matters to our communities most? And do we do it alone? Do we do it alone? Do we stand alone alone and fight for the cause? What do we do? Louder. Mm-hmm. Give me examples. Who would be great supporters?
Many, like of course other advocates who are working in the same agenda, department, and other activities.
Right. Excellent. So we bring other partners on board that we think are essential for our cause. But what's important as we identify other partners to be is mapping out how we engage them, right? So depending on who has the highest potential influence and who has the highest potential interest in your cause, you can map on this diagram how to engage each of the strategic partners. And ideally, you want to bring on board partners that have the high level of influence and also high level of interest in your issue to be partner with you in the cause, in the movement building. But there are other ways of engaging other types of partners. You can inform some stakeholders that you think are strategic. You can just inform and engage with some partners that we think are relevant to open up the gate and the doors to ways of maybe dealing with policy issues that you've been struggling to get addressed. And you can just consult. Yeah? Make sure people are aware of the issue that you're raising. And planning the advocacy also matters. And this is quite critical because when we look at the advocacy cycle, sometimes we need to go through a process of figuring out how best to do that particular advocacy and prioritizing how best to do it. So identifying the issue, as I mentioned before, is a critical first step. And these are some areas that we can use to actually unpack what those problems are. So understanding the issues and the problems, understanding what's causing them, understanding the effects of those issues and barriers, prioritizing what you want to do, what's most strategic, what is most important, what's most relevant. Because it's low-hanging fruit sometimes that you can actually have quick wins and quick gains in order to demonstrate that if I deal with this issue, this is the opportunity behind it. And then making a plan. It's okay to make a plan. Sometimes I think we take for granted that you have the issue, you want to go into the action immediately, but it's okay to take a step back and say, what are the objectives that I'm trying to actually fulfill? So you can actually measure and monitor whether you've been able to accomplish what it is that you need to do, but also to help mobilize resources around your action and campaign. So this is a great framework to work off of in order to make that advocacy action and framework plan, starting with defining the objectives, defining the activities, who are the targets, who are the beneficiaries of the advocacy, but also what are the resources that you need in order to facilitate the activity. And then take the action, most importantly. There's also opportunity for us to evaluate how well we've been able to do. So we ask critical questions around what change do we want to see, and as a result of what change do we want to see, we actually can measure how effectively we've been able to make that change. And creating advocacy messaging around to help support the advocacy. So not so much only identifying the issues, but also identifying the relevant message that we think we could use to facilitate it. And the message has to be short. You've all heard about the elevator pitch, right? You have 11 seconds with a key donor, a key stakeholder, a key policymaker. What is that advocacy message? What is the message that you want to say? And these are just some examples that we have done as ITPC in the past to really drive the message home. Be healthy, know your viral load. What does that say to you? Anybody? Right? Kelvin?
Yeah, for me, be healthy, know your viral load is more like a demand creation statement where you like encouraging, giving information that there is viral load. Like knowing your viral load, you know how healthy you are.
Excellent. Make medicines affordable? Anyone? Go ahead, Calvin. Yeah.
This is more of an advocacy message now, where you're like demanding that pharmaceutical companies make medicines available at affordable prices too.
Right. Exactly. So the idea here on the advocacy message is to make it as clear as possible. Let your audience be able to identify what is your cause, what is your issue. Make medicines affordable. We're already showing here that there are situations where medicine is not affordable. And how do we make them affordable? Watch what matters. That's for us is a community monitoring program. So instead of me saying community monitoring and explaining everything behind it, I'm saying watch what matters. What matters to you? Let us monitor it. Let's check what's going on, right? U equals U. Can anyone tell me about the U equals U? We've heard a lot about it in the conference over the last week. What does it stand for? It's right there. Undetectable equals untransmittable, right? Untransmissible. So again, advocacy message, issues has to be very clear, has to be very short, and say what you mean. Say what matters to you most. So, let me stop talking. Let's hear from you. What change do you want to see for youth and HIV? I want you to write down one clear message. And you can start with, the change I would like to see is... I'm going to open up the flip charts, Everyone take a moment. We'll give you a minute to think of your change that you would like to see with HIV and youth. And if you can just take a moment to come and write your statement on the different flip charts, we'll give you 2 minutes to do that. So 1 minute, what change would you like to see? The change I would like to see is more HIV conferences. Okay, everyone come up one by one and just take a moment to write. The change I would like to see for HIV and youth.
Yeah, let's come up and write the changes you want to see so that we can have a proper and advocacy and activism in the next 30 or 50 years. This is for our generations which are coming forth, the youths and all the young people living with HIV. Feel free, come up and put your views on the charts. Okay, as we have our last writers writing, does anyone want to share the change that they would like to see? Anyone wants to share some thoughts? Yeah?
I spoke about meaningful engagement of a diverse range of positive young people, so that would take into account all of those intersections that exist, and what does that actually look like, having a voice at the table, at all levels of the response and in research, etc.
And why is that important?
Because it's a mantra of nothing about us without us, so you won't get it right until you have young people front and centre.
Well done. Anyone else? There was a lot of comments. The change you would like to see? Anyone want to comment?
Hello, my name is Usani and I'm from Thailand. The changes on here, I speak on behalf of our Thai young teenagers. What they wrote is, I want to see all the youth in my country have good medicine, cheap and easy to get access. I want to see a friendly service clinic and get youth to access all treatment. I want to see the price of the medicine drop at the lowest cost and want everyone to get access also to free medication in my country.
And why is that important?
เขาถาม Can I let them answer เขาถามว่าสิ่งที่เราเขียนเนี่ยเรามีเหตุผลไหมว่าทำไมเราต้องการสิ่งเหล่านี้เอาก็ได้ค่ะ
ขอตอบเป็นภาษาไทยในปัจจุบันนะครับในประเทศไทยเนี่ยยังไม่มีเฟรนลี่คลินิกที่มีประสิทธิภาพแล้วก็เข้าถึงกับเยาวชนได้ทุกคน
It's important for us because in Thailand we don't really have a friendly clinic service because from children clinic they then go immediately to adults clinic, so it's very important for all of our young teenagers to be able to talk and also to express their feeling and also to exchange in a very friendly environment. And of course, definitely, we don't want to see our friends die. We want everyone to live. And as there's medicine, they should be able to access that easily.
Thank you very much, everyone. A big round of applause to everyone. We all have a cause to facilitate. Let's go out there and advocate for what we believe in, right? Go out there, activists, and also be advocates. Thank you.
All right. Thank you so much, Wame. Can we give a round of applause again? All right. So we can see that advocacy and activism is a good thing, and we can all combine our things that we have. Even though you're an advocate, you can also be an activism whereby you can take the things and make action about it all. So we should all know what young adolescents and young people living with HIV, be it key populations, be it young people living with HIV, we are there to put them at the center of the forefront, which is being said by Wame, and also to know what change is needed to be done to see the youth and HIV have access to those health services. So for now, I'm going to give Tumi to give us a bit of an icebreaker, of an energizer on whatever she wants to do it. I don't know, she knows it.
Hi everyone. Hello everyone. Well, I don't feel like people are being young people. I don't think you are young people. Can you all stand? Can we all stand up? When I say stand up, you clap back. Stand up! Stand up! Okay? Okay, you get in somewhere. And then when I say fire, you be like, shh. Stand up! Stand up! Fire! Fire! Stand up! Stand up! Stand up! Fire! Okay, then when I say tsunami, you be like, Tsunami! Tsunami! Thunder! 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 Fire! something. So, I'll say, I take the ball. I take the ball. You all take the ball, right? I take the ball. I take the ball. I take the ball. I take the ball. People don't take the ball. I 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 put it here. I put it here. I put it here. I put it here. I propose. I propose. I propose. Now I need energy. I take the ball. I take the ball. I take the ball. I take the ball. I take. I take. I take. I put it here. I put it here. I put it here. I put it here. I propose. I propose. You propose. You take the ball. I take the ball. You put it here. I put it here. You propose. You propose. You propose. You propose. Tanda! 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 Tsunami! Tsunami! Thank you.
A round of applause once again. Thank you, Tumi. Thank you so much. Now I can feel the vibe. I was getting low. I was also getting low. Now I can feel the vibe in here. So for our next, we are going to have our next session for our next panel. It's for the lessons for the field. And it's going to be moderated by Carlo. And I'm going to give the floor to him. Can you all give a round of applause? Okay.
Thank you. Can I call to the stage Daksha, Tsepo, and Moses, please? Let's see. You can sit, yes, wherever you like. Hi. It's not like this is the best place for us to sit, but I guess it's the place where all of you can see us. So we'll make it work and be as interactive as that last icebreaker. So I'm Carlo Oliveras, and I coordinate the Adolescent HIV Treatment Coalition, which is a coalition of more than 40 organizations that advocate for adolescent HIV treatment access. And I have the privilege today to moderate this panel around lessons from the field. As we have heard from the past speakers and presenters, we have talked a lot about the challenges that young people face in the healthcare setting, and we've talked about demand creation and engaging communities to access services and programs to promising by the provision of information and knowledge building. And we talked about, and thank you, Wami, for that great presentation. We talked about advocacy and activists and what is the role that activists and advocates play in making sure that demand creation happens in order for young people to have access to the services that we need. And for this, we'll have a discussion today around what are some lessons that some of the panelists have learned through delivering in their programs, and what are the challenges that they have faced, as well as the opportunities they see in moving forward. So I want to start us off in the conversation with kind of getting to know us a little bit better. So I'll start to my left with Dasha. If you can talk about where you're coming from, and then pass it on to Tsepo, and I'll come back to Moses.
Thank you. I'm Daksha Patel. I'm from National Coalition of People in HIV in India. I'm based in western part of India, nearby Mumbai, and I'm working in India with the People in HIV community-based organization.
Good afternoon. My name is Tsepo from South Africa. I am the country coordinator for Y Plus South Africa, which is the first youth-led organization in South Africa. And what we do, we are actually advocating for young people's rights and how we can provide psychosocial support. And I think I'll go into more detail later on concerning some of the things.
Yes, good afternoon, ladies and gentlemen. I am called Moses Bwire. I am from Uganda, working with an organization called Peer to Peer Uganda, where I work as the country director. It's a pleasure to be here.
Thank you all. It's hot in this stage, I must say. I'm not sure if there's anything that we can do, but it's quite hot. So, Dacha, we were talking earlier about the project and the piloting that you're doing in India right now, and I think it would be good if the audience could hear a bit more about how that pilot came about and what are you currently implementing on differentiated service delivery for adolescents and young people.
Yes, sure.
Does this work?
Yeah. Yes. Let me first talk about Indian services. Please bear with my language. Sorry. Okay. In India, like we have a 520 ART center, and where out of that 200 ART center providing it's a high loaded ART center, where we are providing 800,000 people linked to HIV accessing the antiretroviral treatment. And is a huge crowd, like each of ART center, and like 400 square feet area, people are getting the medicine. Daily footfall around, we can say more than 200 to 300 people are going to visit ART center. So there is a very limited time for a specific group, almost I will say no, to entertain individual community member by doctors, counselors. So if we will speak about the youth and adolescent, it is a more challenge for them. So what we started, this is the challenge what we are facing in day-to-day basis in health setup. So services are received by, there is an adolescent, specific different group like who are aging people, women linked to HIV, and who are the migrant and young adolescent children, who they all are accessing medicine from same premises. So no any differentiate services for a specific group and specific needs. Like when we see in a role play, the one child wants to go to school, but the doctor is not giving priority. Same situation, our children and adolescents also having a same challenge. So I don't know before in last year what to do for this specific group. But when I attended one meeting in ITPC in Bangkok, I seen there is a community can do lot. By refilling medicine for ART to the specific group and specific community member. And we design our proposal on a differentiated service delivery with including for youth, adolescent, people who are stable, so-called as per the guideline of the National AIDS Control Organization. And this is the program we designed, and we initiated our services with very small scale from last 3 months. But now, when we implemented the services, there are the challenges also coming from the field. Like children and adolescents are always coming with their parents or their caretakers. So they are not easily they are coming to the different setup to access the medicine. And recently in our country, IPT is started by Government of India for prophylaxis of tuberculosis. So that is another challenge we are facing to, as per the guideline in a National AIDS Control Organization, we cannot enroll those community members who are on that prophylaxis medicine.
Thank you, Dacha. So Dacha's talking about the status of the healthcare setting and how the healthcare setting is also struggles in providing these services, and what is the role that you have played. And something that you mentioned that is quite important is what the role of a meeting like the one that ITPC did in Bangkok last year presents for communities in order to improve access to also information and spaces, which is basically what was mentioned earlier by Kelvin around demand creation and the importance to access to information. And jumping off on what Dasha said, I want to go to Tsepo. If you can speak to us a little bit about those lessons that Y Plus South Africa has been able to provide to communities as well as young people in order to demand for these services to exist, as well as what do you think are the takeaway messages from young people living with HIV in South Africa?
Hello. Oh, hi. Back home, within Y Plus, what we have that we are still new. We did a national consultation to find out the actual needs of what the young people are, because we identified that majority of organizational structures work per what young people they think that young people need, but they don't go out and find out what do they actually need. So what we did, we literally find out, and we got a letter from our National Department of Health there, so we can be able to work with all hospitals around the whole provinces. And we had like 2 provincial leads that will actually co-chair and actually manage those programs. And within the consultation, we found out that majority of young people are lacking psychosocial support, and because they don't get any support of mostly when it comes to from their parents, and some of them don't even understand what treatment they're actually drinking, and they just drink it because they've been told that they should drink it from when they were growing up, and some don't even know how to disclose their status to the parents, and some don't know how to actually disclose their status to their partners. So what we did right now, we are planning to do like intervention workshops then and programs where we can literally have those sessions that the issues that they are the most affected areas, where they can be able, like a program for how they can disclose to their parents and how can they disclose to their partners. And there's one of the most important one is having a parental guidance program where parents, how they can disclose to the children on how they can be able, so the young person from an early age, they can be able to tell their parent, like sort of like a young person understanding from an early age on why they're taking the treatment and why they should take their treatment and how they should take their treatment. Because young people actually default, because at the end of the day they find out later on that they're taking the treatment because they're positive, and the stigma that comes ahead of it when they're still in school, the information that they hear, they don't get the education in some of the school systems that we have back home. So that's some of the programs that we're doing.
Thank you, Seppo. And both Dasha and Seppo mentioned something that is crucial, and that sometimes people, when delivering on programs, find that are most difficult is consulting. And how do you do consultations and make sure that people have access to the appropriate information and the adequate information in order to deliver on the needs that the communities face? And you mentioned about adolescents and encouraging autonomy as well. Not just saying that they need to take their treatment just because, it's also how do you encourage autonomy, and we explore with parents and caretakers and healthcare and personnel in the healthcare setting around unpackaging the terms and motivating autonomy for young people and adolescents. So moving on to Moses, can you talk a little bit to us about the peer-to-peer program in Uganda, as well as what have been your experience in order to improve and to make sure that demand creation also happens?
Yes, thank you. Thank you very much. Well, in my country, you'll notice on a number of occasions as we struggle to implement some of our programs because probably we don't know what is exactly on ground, because in most cases we are using generic information that we are getting from this general research information that is conducted. And to address one of these gaps is, as an organization, before we start implementing any program, is we conduct a baseline survey. Every baseline survey helps us understand the terrain in which we are going to implement a program, understand how much effort we have to invest and put forward, because also this is very key for us to be able to understand how much and how well are we going to use the donor resources available, to also pay a lot of critical attention to our outcomes and outputs. Now, as an organization, we pay a lot of critical attention when it comes to engaging young people through using innovations. You will notice that adolescents and young people have different needs, and usually tend to face different challenges. Unfortunately, most of the programs that are being implemented out there are always general. So this was realized with from one of the gaps that were noted within our one of the programs that we implemented earlier, which was called Link Up. And the Link Up project used to be, a general program that was working with young people and adolescents, 10 to 24, and it was noticed that most of the 10 to 19 used to shy away from accessing services because they felt that they would easily be judged by the 19 to 24. So we managed to focus on that. We are using approaches like street theater, which in simple terms, in general, someone can call flash mobs, where we are using entertainment to pass over the information. And this one helps in mobilizing communities for services. Then also, secondly, it also helps in creating awareness. Young people and adolescents like things that are flashy, things that have swag involved in them. And we as an organization, we define that. We define that from how we execute our programs and how we design even our IEC content. For example, the Adolescents Clients Charter that we use as one of the tools within our programs. And we strongly dwell on peer educators, because peer educators are very key when it comes to following up on who is failing on treatment, where they are, and how can we recover them. It also helps in referrals, making sure that there is a complete referral, and also there is adherence when it comes to those who are put on treatment. It also helps on addressing issues like stigma and discrimination. It's an easy buy-in for you to relate with your fellow, this fellow young person who you feel is within your age bracket. Let's imagine if I'm taking weed, if I'm taking drugs, I would feel more comfortable to talk to my fellow friend who's using drugs if he's going to tell me, do you know that abstaining is good? I would easily buy into that than my parent to tell me that my son or my daughter abstaining is good. You get me? Because you feel that if my colleague that I am waking up every morning and in our free time we are taking weed together can tell me that abstinence is good, it could really make sense. So we use peer educators as one of the very, very strong tools that we use in our programming. Then also making sure that adolescent-friendly services are very critical at health facilities. We lose the message when we start to say that adolescent to youth-friendly services is about just having this young person working in a health facility to attend to the young people. I think it's not only limited to that. It goes as far as making sure that it can be a 50-year-old giving the service, but having the young soul at heart. It also helps making things happen. Then finally, we are doing mentorship. Mentorship for us is sustainability for all our programming and what we do. When you create a generation of good leaders every single time, you are able to to have sustainability in terms of outcomes in what you're doing. Thank you very much.
Thank you very much, Moses. So in the interest of time, I'll leave you all with these three thoughts. Our panelists talked about knowing the community and knowing your terrain, kind of assessing where people are and what is the information that they need. Also very important to know your partners. We've heard a lot about the importance of partnership and seeing what organizations are there that can support you in harnessing that knowledge to demand the services that are needed and ultimately act on it. I think Wame left us off with with a great quote on: to be an activist is to speak and to be an advocate is to listen, and we can move forward without both. So thank you all for being in this panel, and we're looking forward to the next session.
Thank you so much, Carlo, and thank you so much, the panelists who are here. I hope we have finally learned something. And back to the audience, just need any of you, if you have questions or comments, to add on the panelists which was here. Questions or comments? Yeah.
Thank you guys for a very good panel. So my comment is only coming to the issue of actually using peers. I think this process has been working, and it's a living testimony to most of our youth networks within our African region, because when we have these kinds of conversation, it actually influences more of emotion within the conversation. And with young people, it always works when you put in emotion, and it brings the best of them and how they want services being rendered to them. Just because I feel like most of the times when we do a research about young people, we always leave out that important component of emotion, of which that emotion actually truly reflects the benefits of actually getting those services, or how they want the services being given. So I think it's more of an encouragement to everyone who works with young people. If you put that component of actually considering the emotions of young people before you do anything, I think we can actually get direction and actually work together, because you won't be stepping on each one's toes, or their toes actually. Yeah, so thank you.
Like it's a learning from the DSD. Like government is thinking as a DSD setup is like task shifting or load shifting to the community DSD model. But as a community member, I am thinking that DSD is not only to make ART center relax or to take more shift the these loads, but it is moreover like a community empowerment and community treatment literacy. Until unless we will not focus on through the DSD, it is always like we are not doing any different. The load will start from the DSD model. So we have to work parallelly with the community empowerment on treatment literacy as well. So that is my thing. The second part is about project having always a limitation, certain funding or certain guidelines and things, but the community needs are different. So like we mobilize a CSR, corporate social responsibility, for 25 children club. So that kind of resource, if we will connect with the different model, it will also helps to provide a different group and provide different services on need base of the community level.
Yeah, very true, very true, very true. We should have connections, and also for demand creation, we should know whom is assisting and also helping adolescents and young people out there, and also engaging the community itself and also the young people at the forefront of this. So right now I'm going to give to Prosper, who is going to give us another icebreaker. As you all know that we are 15 years old, and we are energetic and we are full of energy. So another icebreaker is coming through the way.
Prosper here.
Okay, guys, I want to feed you, all of you. I can see some of you are hungry. So I got special food, but for you to get this special food, I'll ask you to stand up. So this is my special food, guys. So I believe after this, you guys will be full. Because I got a lot of food to feed you. Trust me. So I'm just going to start by here. How many of you love pizza? Pizza. Okay. Some don't love pizza. Okay, it's fine. It's fine. Okay. What about KFC? Kentucky Fried Chicken? Only a few. All right. All right. So we got a number of food, and we got a last one. McDonald's. Big Mac. Ne? You love Big Mac. Okay, guys. So we are going to eat this food. Yeah, we are going to eat all of them, and then we are going to be full today. Isn't it? So you do what I do and you say what I say. Do what I do, say what I say. You do as I do and you say as I say. You guys get it?
All right.
That was wonderful. That was wonderful. Yes, 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 yes. Same as me. I'm feeling hungry. I'm just seeing the McDonald's in front of me, but I cannot touch it. Oh, yeah, right. Thank you, Prosper, for the energizer, and thank you, everyone, for engaging into it. It shows that you are proving yourself that you're 15-year-olds. I wonder how old you are, all of you. I'll have a chance to ask both of you in here. Oh, I'm just kidding. So, for our next part of the session, we're going to have a wonderful Messi Ngulube from Children's HIV Association Youth Committee, UK. She's going to give us making your point and messaging on the communication. So, right now, I'm going to give it to Messi. Give her a round of applause. Yeah.
This is going to be really quick, but I'm just going to go through. I'm not going to try and kill you all with a PowerPoint. But first, I want us to get social. So if you all turn to the person next to you and come up with a 20-second message on how you feel about the conference today, and then we'll move on. So 20 seconds, person next to you, starts now. Okay, guys. So, how many people in the room feel like they could, convey exactly how you feel today? Like, exactly, perfectly to the other person? Yeah? Do you want to come up to the mic and give us that?
Hello, Simon. I would say finally activism on agenda on World AIDS Conference 2018.
Thank you for that. So yeah, this is really just about communications and how difficult it sometimes can be to convey exactly what you want, especially when social media is so short and snappy these days. So I'm just going to run through a few slides. So influencing specific audiences and using specific messages is really key to driving change in activism. And storytelling is a really good way of communicating what you're trying to communicate, but also relating to people on a personal level and getting them to invest their emotions and not just their money and time into things. So how can strong communication support sustainability? So by using visibility, you increase impact, and by that you have good resources, mobilization, and opportunity that comes out of that. And then storytelling can be more effective than other forms of communication because they can help you transmit emotions, like I've said, which is a really powerful tool as a human to motivate other people. So what are some examples of how you can communicate your message in advocacy? Can I just have 2 people shout out? Drama. Good one. Anything else? Wame, you nodded. Oh. Yeah, true. So yeah, these are some other examples in terms of communication specific. So by using, you don't have to use every single thing, but by using these things, you can articulate your message in a way that is understandable to the people you're trying to target as your audience. And this is a cool, these slides will be available, but this is a table that can help you with communications tools. So if you want to take a picture or access the slides later, that would be fabulous. And so we're at AIDS 2018. We get to go home tomorrow. Well, some of us do. But this is really kind of the target audience you're looking at if we're here. So we're looking at communities and civil service, but also donors, bilaterals, policymakers, academics, scientists, and the general public. I think one of the things I want to stress is so often in this sector we just kind of talk to each other, but actually people outside of the HIV sector need to also understand our messages for us to be able to make good impact. So factors you should consider when figuring out how to reach your audience are your reach. So how many people are you actively going to be able to reach on the platforms that you're using? What is the frequency that you're going to reach these people at, and how much is that going to cost you? Is it feasible to say we're going to have billboards in every country and do all this if you don't have the money for that? And how effective would those be? How can people respond to you? Can they respond rapidly? Would it be a slow response? And are you going to kind of repeat what you say in order to drive home key messages? So, for example, Facebook has a very wide reach because it has 2.2 billion users and quite frequent exposure, but it has low effectiveness. So these are the kind of things you need to think about when you're thinking about which platforms to use. And Twitter, 80% of its users access it via phones. And obviously Twitter has increased their character limit, which is great for some people, but actually, the nature of a mobile phone is you just pick it up, put it down constantly. So actually, is it better to be putting long messages and long videos on Twitter, or keeping it short, snappy, to the point, so that it literally is something that people can kind of just read quickly as they scroll by? And social media platforms that you can use to share photo and video content. Things like Instagram, Snapchat, YouTube are really, really good. And I think YouTube is really key for young people in terms of if you're trying to show real life examples of things, and a lot of young people are into vlogs and stuff like that, which I think is really useful for having that kind of storytelling aspect to your activism. And then advantages to using social media for advocacy and communications are that it is in real time, it can be generated publicly, it can be unfiltered, which is so important in this type of activism. I think sometimes when you get institutionalized, you sort of feel like you can only say this and this because this is at stake if you say that, and this is at stake. But actually, if you own your own communications and you have access to platforms that you yourself run and own, then actually you're unfiltered, which is, fabulous. And just remember, guys, that data tells, but stories sell what you're trying to use your data for. So that's all. Thank you.
Oh, thank you so much, Mercy. And thank you so much for the word out there. I see a hand has already been raised before I suggested. Okay. All right. Anyway, I wanted to just thank Mercy for the overall messaging which she was giving us. And it's good to have communication strategies to reach out to the young people out there. As you all know, if you go out there, you can just see all of them with phones. And in here, I can see some of you on the phones, which means messages can be circulated on social media and different platforms. And it's good to reach out to them with different messages. So I can give to one who has suggested anything.
Well, thank you very much. I would like to slightly disagree with one of your slides, where you're saying that Facebook has limited effectiveness. I think for me, I don't believe it's a general thing all over the world. In Africa, Facebook is more popular than Twitter because people feel they can express themselves as they wish on Facebook than on Twitter or Instagram. And even in Africa, specifically Uganda, Instagram is more limited to women than the men. If you say I'm on Instagram and you're man, they will say, okay, that sounds a little weird. Do you believe in too much of fashion? So Instagram is associated more with gender in my country and in Africa. Then I am a success story of Facebook. You get me? No donor knew me. No donor knew Peer-to-Peer Uganda, my organization. I built it from square one using Facebook. Not only that, I built a second company of Facebook, which is more of a profit company, but it also built itself off Facebook from square one. Our first client appreciated our work of Facebook, and we have managed to make things happen. Peer-to-Peer Uganda, one of my other staff is here, Patricia. We are products of Facebook. So I don't really agree when you say, Facebook has limited effectiveness. Yeah.
Thank you so much for that comment, and also telling us that it is limited. As for me in Zimbabwe, in Africa Jandiri, we do have a platform where we can reach out to young people. You report platform whereby young people would ask different questions on HIV and AIDS and anything else, or they might be shy to disclose directly to the health care workers, but
through that platform, they feel free to connect with other peers. And when they connect, they ask various questions, be it SRH and everything else. So thank you so much, Mercy, for bringing it up for the communications and everything. So for the next forum, before I go for the next forum, I don't know if anyone has comments on the slides, Mercy, the wonderful slides which she had given us. Going on round 1, round 2. Don't worry, it's not an auction. So for the next, we are going for the building champions, where we're going to have Grace Ngulube and the interviewers, and also Messi Ngulube, including the youth champions. So I'm going to give the platform to them so that they're going to do what they're going to do.
Thank you very much. We welcome you all to another interesting session of building youth champions. So may I call upon our panelists, Messi, Dawn, and Los Angeles. I hope I pronounced it well. Thank you. Okay, as my friend has already mentioned, my name is Grace Ngulube. I'm from Malawi. I'm working with PADA and We Care Youth Organization in Malawi. So I'll ask my colleagues to introduce themselves.
So I'm Mercy Ngulube. No, we are not sisters. I am from the UK and I work with the Children's HIV Association.
Hello. I'm Lorangelis Thomas. I'm from Puerto Rico. I'm part of GMP Plus, ICW, and Pangea.
Hi, everybody. My name is Tung and I'm from Vietnam. I'm working for Lighthouse Social Enterprise in Vietnam. Yeah.
Thank you so much. As you can see, they are all young. Yeah? Hello? Hello? Okay, as you can see, they are all young and they are stars and they are all looking great. Yeah? So, firstly, maybe I heard you that others, they are activists, others you're youth champions. So, can I hear from you, like, what really motivated you to be youth champion, to be an activist? Yeah? Who inspired you? What happened? What made you to be in that position? Yeah? Anyone can start.
I guess in terms of when I received my status, or like when I found out about my status, I just couldn't wrap my head around the fact that something I'd been living with my entire life had suddenly changed who I was and ripped me of my humanity within the sentence of, oh, you happen to have HIV. And I just wasn't going to take that as like, that's an acceptable reason for me to now have to live life on the margins. So when I was 16, I decided to, speak up and really give young people a voice in the UK, and air my views and see if I could do something that would make our lives better and raise more awareness.
Well, it's not that there are not people that have inspired me, but for me, like what actually motivates me is more the experiences and the stuff that happen in your life. For me, it changed. Like every time you learn new things, every time you get new experiences. And for me, activism is like a door that when you open it, it doesn't close. So you are aware of most of the things that are around you, not only around HIV, but also many other stuff. For me, the activism wasn't just about HIV. The activism started from the HIV, but also makes me become a feminist. It's make me fight for my country. It's make me also to embrace my blackness, my sexuality, and many, many other stuff. So yeah.
I actually 27 years old, so I'm not really young like you guys here, but I'm really proud to be here and to see the very young face in here. It's really cool platform for us to share experience and also learn from each other and inspire. I actually be inspired by you guys here. It's related. I start become the HIV and LGBT activist in Vietnam. It's related with my personal story. When I was in high school, I was born in a small village in Vietnam. And in my high school, I faced with stigma and discrimination and isolation from my schoolmate because of I'm gay. And so that time I also trying to kill myself sometime because of like I don't have anyone to talk to. And my biggest dreams at that moment is go out of my village and go to the big city and see my community there. And in the first year when I was in Hanoi, the capital of Vietnam, the big city, and I was attracted by a lot of new things like handsome guys, like six-pack sexy guys, and I cannot stop myself to have sex with them, and without any information about HIV, of course. And I believe that HIV is something far away from me because my parents told me HIV only in people who use drugs or people who are sex workers. And so then I know about HIV after 1 year without unprotected sex. And I wait for 7 days for HIV result. At that time, I meet one peer educator who gave me a lot of information, counseling, like really patient for me because like for someone who don't know anything about HIV, I had a lot of questions like when I will die if I have HIV, so what will happen for my future, everything. But he really patient to answer all my question without any asking of money or any incentive from that. So that is my inspiration. And after that, I know there are a lot of young people faced with same situation like me, and I decided to speak out for my community. So now I'm really happy to be here. Yeah.
What about you?
Thank you for the question. Okay. Mostly what motivated me to become an activist and one of the young people who really advocates for youth participation. In my country, there was a situation whereby young people living with HIV were not having that space to talk their mind, to give out their views in each and everything that was happening. You find out that there were HIV policies being made, but young people living with HIV, they were not involved. So that really gave me that inspiration that I think I can do this and I can change this in my country. So really now things are really improving. We are being involved in most of the things. Thank you. Okay. I was also really inspired by my sister here. Wame, we have a new meaning of activism. Yeah. She said activism, it's a door that is, when it opens, it never closes, meaning that you still have ideas of what you need to advocate for as a young person, right? Hello? Yeah, so can I also hear from you, since you became activists, since you became stars, what's your experience like?
We can start. I think we should start from this way, so at the end you get the mic. It's easier.
You can open the door and we cannot close. You can open the door.
Okay. Well, now I'm 30 years old, so if you think you are a young person, I'm not. However, I do feel, I feel great having 30 years now because being more HIV positive and knowing that now I'm like 30 years old is like a huge goal for me, so it's amazing. For me, I think that I started doing activism when I was 13 years old. I used to give workshop at my school with my classmates, but at that moment I didn't realize that what we were doing was a political issue, was a political thing. And I think my teacher, like at this day, I think she doesn't see it that way either. And that when first I realized or I identified myself as an activist was in 2012, sorry, at my first internationalist conference in Washington. So after I started doing activism, like the formal activism, when I was 20, 2008, after my only attempt of suicide. And I think that having that experience is what actually bring me to different spaces where I met different women's. And I think that I knew that I was HIV positive since I was 9 years old, so I grew up knowing that I was positive. However, very, very back in my mind, I was thinking that I was being a victim, you know. There are many young people who are born HIV positive that feel, that identify themselves somehow, you know, as a victim, like I didn't get to make a choice or something like that. So it's make us to set some distance from other people that infected with HIV in a different way. So being able to be in that space was actually what started breaking with all this mindset about this victim position, and I started, you know, getting more power to do some activism. Now I think that in these last 2 years, after the Durban conference, and after all 2016, after the high-level meeting, the internationalist conference, I realized that after many years working with regional stuff and international stuff, when I go back to my country, nothing happens. You know, I come here today, I come to this conference, but when I go back home, nothing has changed. So, and after the hurricane and many other issues that are going on in my country, I start working more locally, and you know, instead of coming here and telling you are not doing this, you are not doing that, I started doing stuff myself because I have the power, and I just started to actually making the change that I wanted to see in my country.
Okay. All right, thank you very much. So I have two last questions for Dawn and Macy. I'll come to Dawn. Through your experience, what were your challenges that you have faced as a youth activist?
I think to be an activist, I want to add some things in that question, because I think the most beautiful thing that I can have more sister and brother and friends in the community, and also I can hear a lot of like touching story from the community, and that really beautiful jobs for me in my life. I think all of you may agree with me. The biggest challenges is how we can balance between the personal life and also to be an activist, because like. For me, sometimes I also got some like opportunity to work in some different area, but then to be activist is so beautiful for me. So then I decided to not come back and close the door, but continue our road. But I think that is really excuse for someone here to be an activist, to balance the personal life. When you have time for yourself, you have time for your family, and also for like some personal thing. And with the to be activist, yeah. So I think that is my biggest challenges. But I see more opportunities than challenges, because I have opportunities to learn from the other people, to growing myself and empower myself and empower my community. So that is my experience.
Quickly. also activism is a lifestyle. So self-care is also political. You have to make it political also. Just that.
Okay, thank you very much. So, Messi, what are your plans as a youth champion, as an activist, as an advocate? What are your plans in the next 5 years or 2 years?
Okay, so I'm currently about to go into my last year of university. So I guess beyond that, figuring out what activism looks like, but not in a volunteer sense. Like, I think it's about time young people were like, look, we do all of this stuff and we have to have struggles of trying to balance it with our personal life, but actually there's a role that we have to play that actually should come with some benefit for us. So looking at how I can incorporate that into my life and, continue what I'm doing.
Thank you very much. How many have learned out of this session? How many? How many have they learned something? How many the next year's youth champions, activists? How many? Oh, no youth champion? No activists? All right. Any question, comment? Just a minute. Yeah, thank you.
I'm sorry, I'm speaking a lot. I would just like to also share a small story about how I end up in the civil society. Initially, I started my life as a songwriter and a guitar player, so a performer in simple terms, and that was my dream. But along the way, when I was growing up, one day, I go back home and I find my sister, our firstborn. She was, really, really ill at home, and she had lost a lot of weight, and they kept saying that she had been bewitched, so she had been tied all these local herbs and all that. And I come from a middle class family where at home we were not believing in these things, but all of a sudden they were happening in our home because everyone had lost hope and they didn't know what was really happening. So it was really a shaming that a family of our level, which had gone to school, was that ignorant to not realize that HIV had an opportunity to also be in our home. We thought that HIV would only be for people who are poor, people who are reckless in terms of the way they sleep with others. But here it was in our own house, and dad and mom could not believe it. Not even us. And even after we realized that it was HIV, it took about 9 months when my sister was almost, we were just waiting for the day for her to pass on and we bury her. But she recovered. And for me, ever since that day, I started to realize that it's not right for us to wait for HIV to come into our personal lives or our own families so that we can start to fight, the virus and contribute to making sure that we end it. It's very important that we take it on our personal selves beyond it coming to us before we go to fight it out there. Yeah.
Thank you. So I thank you so much, guys, for taking part in this session. It was really helpful and so inspiring. Thank you.
Thank you so much for the wonderful panelists who were here. I think we've all learned and saw what was happening here. And I want to thank who are sharing their experiences. It takes a lot of courage for someone to tell us his or her story, and also it changes people's lives out there. So we should need to know what we need to advocate for and what types of activism is needed to be done out there so that we can upgrade and empower young people living with HIV who are being suppressed, the key voices and also the voices who are being suppressed. We should dig down there for them. So due to time, we're not going to go straight to the resolution of the common challenges, but we're now going for a wrap-up and our take-home messages. So I'm going to throw the ball to you all so that I can see if any of you have any take-home messages which you're going to
take back to your country and tell them about what you have learned during this workshop and during this conference. Feel free to engage and move around the room. There are mics there, and number 1, 4, and 3. So I'm taking back the ball to you, to the audience. Any take-home messages you would like to tell us about? I know that some of you are going to travel tomorrow, the likes of me. So, sorry, I just heard that there are some young people who want to do a role play to show you something else which has been done. I think you remember the first role play. Some of you who were in here who started with us the workshop. There's a role play which was played, and there were things which were done on the role play. So I'm gonna give back to them so that they can redo what needs to be done, what services needs to be given to the young people in the clinics, in the health facilities. So I'm giving it to Paramani and to Tumi.
You are now here in my office.
Yes.
I know, when you come to this office, all you want is to gossip. Okay,
Yes.
Did you see that one that left, the one that came out first?
Yes.
I think he's the one who came with STIs last time. And now he comes here and he says he's busy, he wants to go to school. Can you imagine? I'm saving someone and he's telling me that he wants to go to school.
They're like that. It's young people. They always sleep around.
Can you imagine? And they are not even using condoms.
And they think they're special.
Can you see the line that is outside? I think I'm going for lunch.
So, what do you think about the treatment? Is it still treating you right?
I don't know, maybe the doctor is different, but the environment looks super.
Nice to see you, Tanaka. It's your time to come. Can I take you to my office? Okay, that's actually how far we went. We wanted to take the act into the future, 2 years from now. We wanted to be a youth clinic with an anonymous walk-in clinic opening before school time. We wanted them to be respectfully met in the reception. We wanted them to know that we have a peer corner. So if you want to talk to someone, you just go to the corner freely if you wanted. And you also had a personal connection with your doctor. So when I approached as a doctor, I just were friendly and we knew each other. Yeah, so that was the changes we did.
So I think the role play has given us the key messages, right? And I can feel that some of you in your hearts are saying, "Whew, wow, at least." So thank you everyone for coming, and I hope that what you've learned in this workshop, you will take it back to your countries. Activism and also advocacy is a good thing. If you combine everything together, we know that activism is an act of acting into action, and also an advocate is an act of listening. So we should know what is on the ground, what the young people are facing, and dig through to those young people whom you know that their voices are being not heard, be it key populations, being young people living with HIV and all various diverse young people out there. They need us, and they also need us to stand for them so that they can access different services. Thank you so much for coming here, and I wish and wish a very pleasant day for you all, and those who are traveling tomorrow, wish you a safe flight. Yeah. Thank you.